Hope that this can be fun and interactive session. And we look forward to the next, 20 minutes or 25 minutes. I'll hand over to Snehal to start.
Okay, hi everyone, this is Snehal. And before we jump into today's session, we would like everyone to quickly put on their camera so that we can click a few pictures. I think everyone has already put on the camera, and so Nupur, maybe you can click, take some screenshots.
Sorry.
Nupur, you're on mute. Yeah.
Yes, yes. Thank you. If everyone's ready with their best smile, internet age. All right, big smiles. Thank you. Got it.
Great.
I'm just going to share the PowerPoint.
Yeah, go ahead. My name is Snehal, and I volunteer at the Blue Circle Diabetes Foundation. And I myself live with type 1 diabetes. It's been 22 years for me. And we'll be talking a little bit about different types of diabetes, what causes it, what are the symptoms, and how we all live with it. So, me and my friends here, me, Nupur, and Sanskruti, we all three live with type 1 diabetes. And we also have Nupur's mother, Hansa, here also. She's also joining us. Yeah. So, Nupur, can you just do it like a full screen? It's coming a little off. We at Blue Circle Diabetes Foundation, we do a lot of activities around awareness and advocacy in India and globally as well. And you can go follow us on all our social media handles if you or anyone in your family lives with any type of diabetes. And we are India's largest patient-led diabetes community. And we take immense pride in the fact that we are patient-led and it's more of an experience led and like a patient-led organization. So yeah, so our aim here is to educate, engage, and empower everyone who's living with diabetes and their caregivers as well. So before we get started, so when we talk about diabetes, basically diabetes is related to pancreas. So any idea where our pancreas is located in the body? Anyone can just unmute and let me know if you are aware of it. So pancreas is probably located in the middle of the abdomen, just below your breastbone and where your ribs start. So, and it starts from the right side of your body to the left side. That's how the placement of the pancreas is. And what does the pancreas do basically? So the pancreas does two important functions in our body. Uh, yeah. It helps in yeah, it helps in the first function it does is it helps in digestion. So it releases some enzymes, some pancreatic juices that helps in digestion of the food that we eat. And the second important function it does is regulating blood sugar levels. So it releases an hormone called as insulin, and we'll be talking a lot more about that as we go ahead. But insulin is something that controls the sugars in your body. So there could be multiple causes of diabetes. A few of them would be it is either hereditary, it runs in your family, or it is genetic. It can be lifestyle oriented. It can be due to organ failure or damage to the pancreas. Now, what are the basic symptoms of diabetes? These are like all Google. Once you Google the symptom, you will get these, and these are very easy to identify. But more often than not, we kind of lose to we kind of do not notice these symptoms on time. So first, like we will just go through a few symptoms here. Frequent urination. You have to constantly go to the washroom, and there's excessive thirst. You feel like immense dryness in your throat. You feel tired all the time. You don't feel like doing any kind of work. There's either sudden weight gain or sudden weight loss, and it's immense. Like when I was diagnosed, I was a very plump kid, but when I was diagnosed with diabetes, I had become like a very thin, like a very stick-like figure, you know. So it's quite an immense change in your weight. You will start noticing that your wounds start healing very slowly. It takes a lot of time, and you probably need some medications as well. There's excessive hunger, and you will feel some tingling in your either in your hands or in your feet, and your vision is also impacted. So if you see anyone in your family having these kind of symptoms, then we can go ahead and do like a very basic tests, so you can do like a random blood sugar testing at a pathology lab, or there's another specific test that we do is called as the HbA1c. uh, Next slide. Yeah. Yeah. So what the A1C test does, it gives you like an average of your blood sugars in the last 3 months. And as you can see on the screen, we have this three different ranges. So if the number is somewhere around 5.6 or less than that, that means it's a normal blood sugar range. You do not have diabetes. From 5.7 to 6.4, you are in the pre-diabetes range. And if it is definitely, if it's about 6.4, then it's definitely diabetes. And if you are already someone who's living with diabetes, then we recommend doing the HbA1c test once in 3 months, so that you know how your blood sugars have been over the duration, and you can go ahead and manage it in a better way. Next slide. Yeah. So here we talk about a little bit about the high sugar symptoms and the low sugar symptoms. But in the center of the slide, you can see how do you check your blood sugars on a glucometer. So I've bought my glucometer here as well. I'll just quickly give you a walkthrough. So the glucometer, this pouch contains the glucometer, the actual glucometer. It contains the blood test strips which are in the box, and it has this uh, device which is called as a pricker. So you wash your hands first very nicely with soap and water, and then you take out the blood test strip basically. So you will have these tiny strips uh, like this, and you insert it into the device. And once you insert it, it kind of starts. This is the way it looks. And then you prick your finger, take a tiny drop of blood and insert it on the strip, and then the glucometer will give you the reading. So here we have given the range, what is a normal blood sugar range and what is a high and what is a low blood sugar. So if your sugars are between 70 to 180, it's a normal blood sugar range. If it is low, which is below 70, then you will usually have the symptoms which are mentioned in the PPT. We have sweating. There's you can even feel dizzy. You can, at the worst situation, you will faint, but you will find difficulty in focusing on things. There's a lot of confusion. You can also have emotional changes like feeling angry or feeling irritated. If your sugar is above 180, it's called as the high blood sugars. And you will again have the symptoms of frequent urination. You will feel thirsty. You will feel hungry a lot. You'll feel tired. You'll have blurred vision. So these are the symptoms of high sugar and low blood sugar, and the way you can check your blood sugars on a glucometer. Now, in the beginning, I said that I live with type 1 diabetes. So I'm sure a lot of you must have this question of how type 1 diabetes is different from the regular diabetes that people usually talk about. So type 1 diabetes is something, it's an autoimmune condition wherein the body considers the pancreas and its cells as an enemy and destroys it. So that is an autoimmune condition. And in this case, the body has already destroyed all the insulin producing cells in the pancreas, and there is no way that we can regenerate that. As of now, there's no research or no cure for that. So the only solution that we can do is we have to inject, or you have to take insulin separately. And we'll talk more about how to take insulin in the next slides. Type 1 diabetes cannot be reversed, and it can happen at any age, and it cannot be prevented. So this is something that me, Nupur, and Sanskruti here live with. Type 2 diabetes is something which we call as a general diabetes or the regular diabetes that everyone in our family, one or two people in a family usually have. So it can either be like a metabolic condition, or due to some damage to the pancreas, or it can be a lifestyle oriented disease as well. In this situation, the body is producing some amount of insulin, but it is highly resistant to insulin. It can be reversed with the help of managing proper diet and like following a regular exercise regime. And it can happen at any age, and it can be prevented. So going ahead, we'll talk more about how to take insulin and the diet and exercise that you follow if you're living with diabetes or if you are in the pre-diabetes zone. So I'll hand it over to Sanskruti. Thank you.
I am so sorry, I forgot to unmute myself. Let me introduce myself again. Hi, my name is Sanskruti, and I have been living with diabetes for the last 10 years now. And today we will be talking about what and how many different things affect your sugars. So, as you can see, lifestyle is something we all know has ruined the current generation's health because the continuous looking on the phone and the hectic work schedule, which requires people to sit in one place and stare at the laptops and phones, it is just, going to ruin their metabolism and their lifestyle. So, this is what I want to, tell that I have been inspired by various people in my life, and one of them are, my grandfather, who is right now 90 years old and still tries to do a little bit of his chores. Every day includes a morning walk and an evening walk in his routine. So including exercise in your routine is very very important because it takes care of the sugar hikes that you go throughout the day, like whatever you eat, even if you're eating like a little bit of something, it is going to give you a little bit of spike in your sugar levels. So when you include exercises, just a simple walk of 10 minutes to 15 minutes before or after dinner, or a morning walk, or an evening stroll with your friends, or just like how you all did yoga right now, it is going to help and manage your sugar level spikes, which you will get after eating anything. Not necessarily spikes, but your sugar will go up or down throughout the day, even if you don't eat something, or if you eat something. So there are consequences both ways. So including some type of exercising is very very important. And this I'm saying as someone who was born in 2001, and I am telling this to people who are way older than me, and I am quite sure you are all are very very strict about your routines and always include some kind of exercising. So just a heads up that I did not include a lot of exercising in my routine, and my metabolism is ruined, I feel it. So here are some different types of insulin delivery. There is syringes, there is insulin pen, and then there are pumps. So here I'm going to show you an insulin pen. You can see that is in the middle of the picture right here. So it looks something like this, and the insulin cartridge is here, and there's a needle over here. I don't have the needle right now because I don't use a pen. I am on insulin pump, which looks something like this. So there's a cartridge attached to this machine, and with a press of a button, I can take my medicine while walking, or while literally running, or while doing anything throughout my day. So this is attached to my body 24 by 7 while sleeping. While bathing, I can remove it, but it is attached to my body almost 24 by 7. And I do remove it, if you're doing excessive cardio or excessive exercising, which does not require basal insulin, I remove my pump then. But these are some kinds of insulin delivery modes. So I'm going to take a
So
look at
just to
it.
add to what Sanskruti showed, I'll show you the syringe because I use a syringe.
Yeah.
So this is the syringe that we use for
So
insulin delivery.
there are syringes which are basic mode of insulin delivery, I feel.
Yeah, Sanskruti, go ahead.
Yeah. So next slide. Physical and emotional strength. This is something I would like to talk about. I was diagnosed with diabetes when I was at the age of 13, and I was in like shock and confusion, like what is happening with me. So I want to tell you as a viewer, like if you see someone who's going through this change in their lifestyle or change in the condition, it is very important to not give them the burden of, something was wrong with you, or you did something wrong, or because of you, you got this chronic condition, and you are going to live it throughout your life, or you will not live a healthy and full life ahead. So if you are a viewer and you know someone who has been diagnosed with type 1 diabetes or diabetes, do not tell them that this is their fault, or this is their mistake, or they didn't do something which has gone wrong and resulted into being diabetic. So it is very difficult to go through this on daily basis, take medicines, understand how much sugar it will spike on eating a particular food item, or not eat a food item and take insulin and then end up in a hypo, which is very low sugars. So it's been a roller coaster throughout these 13 years, and it is very important to not tell people that this is their mistake. And again, what you can do is just listen to them without giving them any suggestions or telling them what should they not be doing. Like, if I tell someone, oh my god, my sugars are high, and they tell me, oh, you must have eaten something, or you must have not exercised, or you must have not done this. So these are suggestions, and these are telling them, okay, you have not done this. But it feels like, we are not doing one more thing that we are supposed to do. And you can offer them an ear to listen, and just not tell anything which will, they will feel like, okay, it's okay. And you can just give them the support that they need. Nupa, take me to the next slide. Don't bully a person with diabetes. So I have heard this 1,000 times. Like, every time I meet someone and I tell them that I am diabetic, or I have been living with type 1 diabetes since like 10 years now, they tell me, oh my God, you are sick, or you'll get better, or things will go fine, or, anything like that. So when you tell someone who has to live with a condition for all their life, you tell someone that they're sick or they can get better, it just gives a negative impact of them feeling that, oh my god, I cannot do a certain thing, because when you're sick you need rest and you are dependent on someone. But we are going to live with diabetes for all our lives, and it is not reversible, as Snehal mentioned, and we have to live with it. So I feel that you should not be telling the people who are living with diabetes that they are sick, or they will get better. What you can do is, you sorry, just tell them, it is just a condition when you require something, like when you need specs, when you can't see. So we require insulin just from the outside. So it is very important to tell someone that they that things are fine. They just need an extra pair of an organ from outside, and nothing much. So stop telling someone that eating food item can cause them food something a particular food item can cause them a spike in their sugar level, because if they're eating that food item, they know what is going to happen and they have made that decision. So I think that is all from my side right now.
Hi, I'm Hansa. I'm a caregiver to my daughter Nupur, who's been a type 1 diabetic for the last 29 years. And today, what I'm going to talk to you about is our journey all along with respect to the food and the lifestyle that we lead. We are all well aware that day in and day out, people keep talking about eating healthy and what is good for us and what works for us, what doesn't work for us. So we'll have a quick interactive session with regards to that. And if time permits, we are happy to, answer some questions from your end. You can unmute yourself and be happy to take your questions and answer them. So coming to food and our lifestyle, uh, when we talk about healthy food, what we're trying to say is that we'll try and eat as much as natural food as possible. That is, avoid packaged food, processed foods, junk food, so that our body doesn't age earlier than required. our body ages much faster with packaged foods, with processed foods. In order to live healthy and to stay bodily young, what we need to do is make the right choices for the foods that we eat. Generally, we eat like for years that we've lived, we all have eaten roti, sabzi, dal, chawal, and when we come to non-veg, it would be eggs, chicken, and so on and so forth. But with the realization and the research that we're looking at, we see that there are things that we can avoid to ensure that we live a much more healthy life. For instance, when we talk about a good health these days, we're talking about foods that have low carbohydrates. We all know that food has protein, fats, and carbohydrates. And carbohydrates are generally damaging our body. So what we can do is to cut down on carbohydrates in the sense that we can cut down on sugars, white flour, we can cut down on grains and focus on fresh fruits, vegetables, and if, of course, we have the vegetarian food, then we can focus on eggs, chicken. So these are all healthy foods to eat so that we can maintain our body in a much healthy fashion. Like we've seen these young girls who've been living with diabetes for no fault of theirs for the last 10 to 20 and 30 years. What is important to see is how they are managing this lifestyle of maintaining good sugars so that they do not have any complications in future. So our own agenda here is just to share with you what we've gone through and what helps and what works for a general well-being. So if we cut down on carbohydrates, like if we cut down on grains, sugar, that will only help us to manage ourselves better. We also talk about intermittent fasting these days. We've all fasted for some religious purposes, for some spiritual purposes, and for various other reasons. And the intermittent fasting, what we look at these days, is all about maintaining good intervals between eating, which means that we eat at fixed intervals and we cut down on the duration what we eat. For instance, if we eat our dinner at 8 in the evening, we can have our first meal maybe at 10 in the morning. So this gives us a good gap of about 14 hours or 12 hours of fasting, which gives our body the time to heal and to digest the food that we've eaten. So if you have any questions, any thoughts about food or intermittent fasting, we're happy to answer those questions. Please unmute yourselves and ask these questions so that we can take this further.
All right, I'm gonna pause the the sharing of the screen now, and if there are any questions here that our friends would like to ask or any experiences that you'd like to share, please share with us, and we'll be happy to discuss with you. And also thank you to our friends Snehal, Sanskruti, and to my mother.
Thank you guys for this. I have one question again pertaining to seniors. Can you not have diabetes when you're young and get it when you get much, much older?
Ladies, does any one of you want to answer this one, or should I take it?
So if I understand the question, you're saying that people can get diabetes at younger age as well as the older age. Is that right?
Yes. Can you not have it when you're young and say get it when you're 70?
Yes,
Is that?
absolutely.
Oh, okay. It's
Absolutely.
possible.
Yes.
Okay.
So initially, type 1 diabetes was called as juvenile diabetes, saying that it can happen only to kids. That is the pattern that we used to see, I think, 10 years ago or so. But now in our community, we have a lot of senior citizens as well who have developed type 1 diabetes, maybe at the age of 65 or 70. So now that thin line of type 1 diabetes being a condition for the kids and type 2 diabetes for the older people, that condition is no longer valid. Like anyone can get either type 2 or type 1 diabetes at any age. We even have kids as young as like 11 or 12 years old who have type 2 diabetes as well.
Oh, thank you. And one more question before I leave it to everybody else. Does your weight, current weight, matter in terms of risk of getting diabetes, assuming that all of us are, let's say, 60 and above?
Yes, yes, I'm happy to take that. So, definitely weight plays a huge role. So Snehal, in the beginning, talked to us about insulin resistance when she highlighted the difference between type 1 and type 2 diabetes. And type 2 is primarily related to insulin resistance. And like Snehal was saying, it's a metabolic condition. So, the more weight we have, the more likely we are in some way to develop type 2 diabetes if we don't already have it. That doesn't mean that every single person who's overweight will have diabetes, but the chances go up. So with this fast paced lifestyle and with junk food and less exercise, and the weather being so hot in Bombay, and it's a challenge to sometimes keep our weight down for some of us as well. So definitely the weight comes into play.
Thank you. Anybody else would like to ask a question? Please unmute yourself and ask, please.
Does anybody have diabetes here and is comfortable to share with us if they do or if their family members have diabetes?
Or if you have any questions related to food or what we can eat, what we cannot eat, if we can substitute anything, just feel free to ask us.
Actually, that leads us to an interesting question. We understand that junk food and empty carbs tends to increase this. Is there anything that we can do as a senior to ensure that we eat right? Obviously, no junk food, so that the risk of diabetes gets lesser. I remember my parents telling me that to eat karela more often. I hated it, but things like that. Are there any good remedies or ways to keep diabetes at bay besides controlling weight and not eating junk?
Yeah. So maybe I could request my mother to jump in here and share from the perspective of someone who's older.
I'm happy to share my personal experience as well. So the last couple of years, maybe 8 years or so, as a family, we have cut down on grains, sugar, and we are mostly focusing on anything that is, low carb, so that it works well for us. And personally, my all the prominent markers have improved considerably. I'd lost about 15 kilos of weight, which I had put on because of hypothyroidism. And my BP, which was, well controlled, but has gotten better. My medication has gone down. And my skin condition for the last 5 decades, which I have gone to the best of dermats, and they haven't been able to help me out, has worked well with low carb food. So personally, for me, it has been a win-win situation, I would say. And it has been, a journey which has been a little trying, but all the same, eventually what is
Yes,
the outcome is, I would say that I'm extremely happy to say
the
that
20th
cutting down,
of May.
whether it is grains, And being vegetarian is very difficult for me because my protein has to be, in place. So I ensure that I have paneer and tofu as a supplement in my daily meal. Whereas for non-vegetarian people, I think it's much easier supplementing with eggs and chicken and so on and so forth. So I would say that cutting down on carbs is one of the major factors which uh, helps in physical improvement of your body, also in the mental clarity. So I feel much sharper and clearer in my head. I feel physically more active compared to 8 years before when I was like 55, 56. So it has definitely worked. And this is my personal experience and my journey, which I'm happy to share with you on this platform, that it is a win-win situation if you consider going low on carbs. Thanks.
Also,
Thank you,
I
Hansa
want to
ji.
jump in. Sorry, could I quickly also touch upon the Karela, because this is a favorite, and I'm glad you asked it and brought it up. So there's no one thing that will, solve the problem that diabetes brings on. If you just have Karela every day, in the garden or at home, but you're still eating pastries and you're still eating, like a lot of puris or, a lot of high carb, high fat food, that Karela is going to have no impact, no benefit on your body. So, it's about bringing your diet and your lifestyle to be overall healthy. Yeah.
Absolutely agree with you. So if your overall diet is balanced, and on top of that, if you're having maybe amla ka juice or karele ka juice, that will definitely help you a bit in managing your blood sugar. But the four major things that we like to highlight in managing diabetes is continuing your medication on time, following a proper diet, following a proper exercise regime, and checking your blood sugars on a regular basis. If you follow all of these four pillars of diabetes management, I think you can have a very healthy and active lifestyle.
All through this journey of moving from wheat to jawar and to ragi, and now we move to coconut flour and peanut flour, and eventually we've given up rotis and we don't miss them. So it's a
Where do you
journey
get the
that
coconut flour from?
on Amazon you can get them. I can send the links in a short while to somebody over here, and we can get it at Amazon. Everywhere it's available online. Any food
There's
shops,
another one called red wheat. That also is very good, they say. Some red wheat or something. It is very nice
Yeah,
for
I guess
this thing,
khapli, red
diabetes.
wheat, they all say correct. Yeah, but the better options, Ashaji, is that if you go in for coconut flour, these are much lower, more in fiber, more satisfying, and it helps you manage your sugars even better.
Thank you for having us here today. Before we're out of time, we just wanted to say thanks for having us and listening to us patiently. And it's been a real joy chatting with all of you all. So lovely evening.
Nupur and
Thank
team, you
you.
guys do
Thank you.
inspirational work.
Thank you.